Hello, welcome to my channel. In this video we are to talk about the various anti-ulcer agents. In the previous video we got to know the classes of the anti-ulcer agents. So in this video we are to talk about the various classes, and then we will be starting with proton pump inhibitors as our first class of anti-ulcer agents. This is the brief outline. A small introduction will be given, and then majority of the video will be on the mechanism of action, side effects, interactions, as well as some useful counseling that we can give to our patients, and also information that we pharmacists can also give to other health. So proton pump inhibitors, they are one of the most effective anti-ulcer agents. And then from the name, proton pump inhibitors, basically what they do is to inhibit the enzyme that produces the acid, which is proton pump. Another name for that enzyme, as we discussed earlier, was the hydrogen potassium ATPase, also known as the proton pump. So there are examples of these proton pump inhibitors, and some of these examples are omeprazole. Omeprazole was the first proton pump inhibitor to be FDA approved. We have its S isomer, which is S-omeprazole. It's an S isomer of omeprazole, and as an S isomer of omeprazole, it tends to have a consistent acid suppression and decrease side effects as compared to the omeprazole. We also have the rabeprazole. One of the common brand name is Pariet. This also has a rapid onset of action. We also have lansoprazole, pantoprazole, and then this lansoprazole. Okay, so the mechanism of action of proton pump inhibitors. First of all, proton pump inhibitors, they inhibit the hydrogen potassium ATPase, and they are only able to inhibit the proton pump which are actively secreting acid. Alright, so when you take in the drug, because these proton pump inhibitors, they come in as enteric coated dosage forms, they are able to travel along the GI past the stomach acid, because they are able to withstand the stomach acid, and then they get into the small intestine. So the absorption of proton pump inhibitors occurs in the small intestine, basically the duodenum. So the absorption occurs in the small intestines. That's where the drug will be absorbed into the blood, and then the blood will circulate, and then when the blood gets or is supplied to the stomach, we are focused on these cells in the stomach, which is the parietal cells. They are the cells that contain these proton pump. So when the drug gets to these parietal cells, they inhibit those proton pumps which are actively functioning, which are actively secreting. And what they do is, these drugs, first of all, they themselves need an acidic environment, so they make use of the acid being produced by the parietal cells to be activated. So first of all, these drugs, they are prodrug. So when you take them, they are not active. When they get to the parietal cells, they make use of the acidic environment to be activated to an active form. That's where it is that active form that bind to the proton pump by forming what we call a strong covalent bond. They bond strongly with the proton pump such that the proton pump cannot pump H plus or cannot pump acid anymore. So if this is the drug and this is the pump, they form a strong bond with the pump. There are a lot of pumps, so they form a strong covalent bond with the proton pump, preventing it from producing more of the H plus ion. Mind you, as I said, the drug itself is a prodrug, and they need an acidic environment in the parietal cells to be activated. That's one of the reasons why we normally advise patients to take the proton pump at least 30 or 60 minutes before food. And one of the reasons is that about 30 minutes or 60 minutes before food, since you are thinking about eating, your body will stimulate the proton pump to produce what? Acid. So they will be stimulated. They are actively secreting the acid. So that when the drug gets there, there is an acidic environment for the drug to be what? Activated. So taking the medication 30 to 60 minutes before food, first of all, allow the drug to be what? Activated. And also, taking it 30 minutes or 60 minutes before food is around that time is when the pump are actively what? Functioning, or they are actively secreting. And mind you, as we said, the proton pump inhibitors, they actually form a covalent bond with the actively secreting pumps. So it means if you take the medication 30 minutes or 60 minutes before food, the medication will be able to go and bind to the actively secreting pumps, and then they will function effectively. So it is very prudent to counsel your patient to take the medication 30 to 60 minutes before food, and the reasons are for the drug to be activated and then for the drug to function effectively. And also, the extent or the degree of the formation of the covalent bond will determine the duration of the medication. So the longer the formation of the covalent bond, mind you, that bond is actually irreversible, will determine the duration of the medication. And also, the degree of acid suppression, as in the extent to which these drugs will be able to suppress the production of acid, increases over time, normally over 3 to 4 days. So it is very important for you to counsel your patient that he or she has to continue to take the medication. He might not actually get relief from the beginning, so he or she needs to take the medication, and we expect a symptomatic relief the 3rd or 4th day, the 4th day going. The liver is the major organ for the elimination of proton pump inhibitors. So normally when we talk about drug elimination, we are thinking about the liver and the kidney, but for proton pump inhibitors, the main organ to eliminate the drug, to metabolize the drug, is the liver. And the liver make use of this particular enzyme known as the cytochrome 2C19 enzyme. This particular enzyme also play a role in the effectiveness of other medication, and for that matter, omeprazole and esomeprazole in specific, they are able to inhibit this enzyme, and when they are being given with other medications, they can interact with those type of medications. Also, as we said, the body make use of the liver to eliminate these drugs. For that matter, if you have a patient who is kidney impaired, you are not really worried because you can give these drugs. So in kidney impaired patients, there is no need for dosage adjustment. So no dosage adjustment. And the reason is that the body does not make use of the kidney to eliminate the drug, because if the liver of the patient is functioning, then it's fine, because the drugs are being eliminated or metabolized by the liver. There is a problem if we have a patient who is hepatic impaired. So for such patients, we have to be cautious, or we have to reduce the dosage so that higher levels of the drug will not be in the patient system for it to cause harmful effects. So for like omeprazole like this, in hepatic impaired patients, we make sure that the maximum dose in a day shouldn't go beyond 20 milligram. For esomeprazole, we make sure that the maximum shouldn't go beyond 20 milligram in adult, and then shouldn't go beyond 10 milligram in a child like 1 to 11 years. So as I said, you are only concerned when there is hepatic impairment. When there is kidney impairment, we are not worried about dosage. We can just give the medication. That's only if the liver is actually working. We move on to the side effects. Side effects. So with proton pump inhibitors, we have short-term effects. Short-term, when you take the medication, not for too long. These are effects that you can manifest. And we also have long-term effects or long-term side effects. These are those things that comes as a result of using the medication for a longer period of time. So with a short-term side effects, commonly headache. Headache is one of the commonest side effects of proton pump inhibitors. So you have to make sure your patient is aware that this medication might or is likely to make you feel headache or make you feel pain in your head. As with most drugs, nausea is also one of the short-term side effects. We also have rash. Some patients can actually react to the medication, and this can lead to formation of rash. We also have upper respiratory tract infections. So one of the short-term side effects is that, and this is a side effect, not everyone will experience those side effects, but some of them you have to make the patients aware. And then to the long-term side effects, as I said, these are the effects that the patients will experience when they are on these medication, the proton pump inhibitors, for a long period of time, like 3 months to about 6 months and a year or more. So some of these long-term effects are actually due to the fact that since you are taking this medication to reduce the production of acid, you are reducing the production of acid, it will get to a point you will get what we call hypochlorhydria. Hypochlorhydria or hydria, depending on where you go to school. It's a state where, right now, you've suppressed the proton pump to the extent that you can't produce enough acid anymore. Acid production is not bad, but too much of it is the issue. The body uses the acid for a lot of things like digestion of food, as well as some absorption of useful nutrients. So when you get to this state, one of the things that we are worried about is nutritional deficiencies. That's one of the long-term effects. And this is because some useful elements like iron, like calcium, like magnesium, and some vitamins, especially vitamin B12, the body make use of acid to cause or to allow the absorption of some of these nutrients. So you see, right now you are taking something that is reducing the production of acid for a long period of time, and then you've gotten to this state, hypochlorhydria. Now the iron that you are taking in through food or through supplements and other things cannot be really absorbed, or enough of it can't be absorbed. And the reason is that these elements, iron, calcium, magnesium, vitamin B12, as well as other drugs, they make use of the acidity of the stomach to help with their absorption. So if you are on the proton pump inhibitors for a long time, you tend to have low levels of iron, and that can lead to what? Anemia. Calcium, low level of calcium. You know, calcium is a very good mineral for the bone, for bone density. And for that matter, you can also talk about osteoporosis as one of the long-term effects because of the low calcium level due to the hypochlorhydria. Low levels of magnesium. The patients will tend to have low level magnesium disorders like muscle twitching, involuntary muscle movements, and the likes. Vitamin B12 deficiency. So as pharmacists, you have to be aware of some of these long-term effects. Educate your patients on them, especially patients who are on this medication for that long period of time. And you can recommend that they regularly monitor these levels so that we make sure that they don't go below their lower levels. So for patients on these proton pump inhibitors for long-term treatments, normally as one of the counseling points or as one of the recommendations, you can offer to give these supplements, iron, calcium, magnesium, B12, and also just monitor to see if the levels are low. I'm not saying you give these supplements always. You are only going to give it for patients who are on long term, who are on the medication for a long term, normally 3 months or more. You wouldn't see these long term effects when the patient is on the medication for a short period of time. Yes, and the last long term effect that we can also talk about is can increase the patient's risk of certain infection. So the body actually uses, or the acid in the stomach is also useful because acid is very irritative to certain microorganisms. So it prevents these microorganisms from growing or colonizing the GI or the stomach. Right now you are taking something that is suppressing the production of this acid for a long period of time. So some organisms may now become or may now grow horns. They may show of some organisms like salmonella. So you tend to have salmonella infection, campylobacter, and then etc. Most of these infections are enteric infection. So these are the long-term effects. Our first interaction will be between clopidogrel and omeprazole or esomeprazole. So clopidogrel is an antiplatelet. We make use of it in stroke, in myocardial infarction, and it actually prevents platelet from aggregating so that clot formation will be prevented. But clopidogrel is a prodrug, meaning it needs to be activated for it to be function. And clopidogrel make use of a particular enzyme to activate it, and the name of that enzyme is cytochrome 2C19. We came across this enzyme earlier. So cytochrome 2C19 will act on clopidogrel and convert it to its active form so that the clopidogrel will be able to work. But omeprazole and esomeprazole, as we already discussed, are able to inhibit this same enzyme. And what will happen? You are inhibiting this enzyme. It means your clopidogrel wouldn't be activated, and for that matter, it wouldn't be effective. So if you have a patient on clopidogrel and the patient is also to be given a proton pump inhibitor, then you have to be mindful of this situation. And a way that you can help the patient is to go in for a proton pump inhibitor which has little or no effect on the 2C19. And one particular one we can talk about is the rabiprazole, which is found in pyrate. So if you have a patient on clopidogrel and you want a proton pump inhibitor, the best option is rabiprazole because it has little effect on the 2C19. If we don't have rabiprazole, what we can do to help the patient is to use the lowest effective dose of the PPI. So we use a dose of the PPI which is relatively low but still effective, so that the inhibition on the 2C19 will be quite less. But this is not actually helpful. The best option is to go in for rabiprazole or pantoprazole because these PPIs, they have less effect on the 2C19. Or instead of using PPI, we can use another class of anti-ulcer agent, which is the H2 antagonist. So we came across this earlier. They don't have any effects on 2C19. They will be able to also inhibit acid production, but they wouldn't affect the activation of clopidogrel. But the only situation is, or the only problem is, the H2 antagonists, they are less effective than the proton pump inhibitors. So the second interaction that we can also talk about is between levothyroxine and the proton pump inhibitors. So levothyroxine is a synthetic thyroid hormone, and then it depends on the gastric acidity or the acid in the stomach for what it to be absorbed into the bloodstream. If someone is on levothyroxine and the same person is on PPI, you are concerned about the absorption of levothyroxine. Why? Because as we said, PPI, they will decrease acid production. Do you get it? So right now the acidity of the stomach is reduced, the H plus ions are reduced, and levothyroxine depends on this H plus for it to be absorbed into the bloodstream. So the absorption of the levothyroxine will be reduced. So only a little or even small amount of the levothyroxine will get into systemic circulation, and that might not be effective for the patient. So with this one, how can we help the patient, or how can we solve this situation? So one of the ways to solve the situation is to separate the administration of the two drugs. So you counsel the patient that he or she should take the levothyroxine first. Now, levothyroxine is taken on an empty stomach, just as the PPI, so 30 to 60 minutes early in the morning, and then at least 4 hours later, he or she can also take the proton pump inhibitor. Giving that space allow the levothyroxine to be absorbed better than giving the levothyroxine and the proton pump inhibitors together. One of the ways you can also help to increase the bioavailability or increase the amount of levothyroxine in the systemic circulation is to increase the dose of the levothyroxine. So as we said, the levothyroxine absorption will be reduced because of the fact that hydrogen productions, the H+ production, are reduced. So for us to get a quite effective amount of levothyroxine in the system, then we have to give more, and that is to increase the dose of the levothyroxine. The last interaction that we can talk about is certain drugs which depend on 2C19 for their elimination. So as we said, the proton pump inhibitors, they are metabolized by the 2C19, and some of them, like omeprazole and esomeprazole, actually inhibit the 2C19. What if the patient is taking the proton pump inhibitors with other drugs that also depend on 2C19 to be eliminated from the body? Meaning these drugs wouldn't get the chance to meet this 2C19 for the 2C19 to metabolize them. So the levels of these drugs will be higher in the blood, and that can cause harmful effects for the patient. Some of these drugs include diazepam, carbamazepine, warfarin, and phenytoin. So anytime that a patient is on any of these drugs and a proton pump inhibitor, you advise that we monitor the levels of these drugs so that the levels wouldn't be high to cause harmful effects, or if better, we try to avoid the combination of these drugs, or we reduce the dosages of these drugs. So in this video, we talked about proton pump inhibitors. From introduction, we gave some examples, the mechanism of action, the short-term and long-term effects, and then the interactions. And along the line, we were talking about some counseling points, how we can help our patients, as well as give useful information to physicians. This is my channel. Please subscribe, like, share for more.